Thank you for that introduction. I'll be starting off by talking about how we can actually balance risk with trying to live our lives as we move through the different stages of this pandemic. And I know some of the viewers here are coming from different parts of the world and you may be experiencing different things, but I think the overall principles are applicable across the globe as we sort of wax and wane in terms of the number of cases that we're experiencing of COVID-19. Next slide, please. I'll start off just by quickly reviewing where we're at in this pandemic. And as I mentioned, many of us are experiencing different parts of the pandemic. And at the very top of the slide, what I've got is somewhat already a bit outdated. It's a summary of the number of cases across different parts of the world. And you can see that the number of new cases of COVID-19 that are occurring globally continue to rise, and actually quite rapidly. We're at a very interesting stage where wherein the global pandemic is really quite active and driven by a rapid explosive growth of cases in parts of the world like the United States, Brazil, and we're seeing some of the largest numbers in cases being reported in a 24-hour period in the last couple of weeks. Whereas the lower curve that you see on the screen here is showing what our epidemic curve is in Canada. And we're really experiencing a different story here. So in recent weeks, we've seen a really nice dramatic decrease in the number of cases over time, showing us as we're on the downslope of this curve into a period of time where we can consider trying to open up and reduce some of the restrictions we've put in place to manage the transmission of the epidemic. Next slide, please. So what's all the fuss about, though? I'm not going to spend too much time talking about COVID-19 infection itself, but I did want to take one moment to compare and contrast with another very familiar respiratory virus that we see, and that's influenza. So COVID-19 and influenza are both things that we see infecting humans and causing respiratory illness. So they have very similar clinical presentation, signs and symptoms. People develop coughs, shortness of breath, fever, feeling generally unwell. So one of the main similarities between the two is that they can look quite similar when you're affected by them. And along the same lines, similar types of people are more vulnerable to getting these infections. So those with underlying lung disease, heart disease, immune compromise, for example, seem to be more affected by both of these infections. Because they're both respiratory viruses, they share the mode of transmission. And I'll talk about that a little more detail in the next slide as I discuss how you can actually get COVID-19 infection. And influenza is seasonal, whereas COVID-19 may or may not end up being seasonal in terms of what we see with the pattern of transmission over time. Right now, we're in the midst of a global pandemic, so it's a little hard to know, and it's far less predictable what we're going to deal with in upcoming years if COVID-19 becomes one of our other seasonal viruses. There are some really notable differences between the two, though. So this is SARS-CoV-2, which is the virus that causes COVID-19 infection, is completely novel within the human population. This means that no humans have experienced infection with this prior to the beginning of this pandemic, and so we're all susceptible to infection. There's no pre-existing immunity to help protect some people from getting infected. So that's really critical because you have this ability for it to transmit quite efficiently from person to person. We also see that from what we're experiencing in the epidemiology, analyzing the epidemiology of the outbreak, is that this virus is being transmitted more efficiently than influenza virus from person to person. So it seems as though it is more infectious than the influenza virus. It also appears to be more lethal. So overall, our estimates are the case fatalities rate of COVID-19 infection is somewhere between 1 and up to 3% in most populations where we've seen larger outbreaks. With influenza, we have a moderately effective vaccine. It's not perfect, but 40 to 60% of people who get the influenza vaccine every year are protected from infection. Hopefully, we'll be in a similar place where we have a vaccine available for COVID-19 someday soon, but at the moment, we don't have that tool at our fingertips, so we do have to manage it differently. And finally, some of the secondary complications that people get when they get infected with COVID-19 are quite different from influenza virus infection. And that includes having a propensity to have clotting events within the body, for example. And we're seeing this very pronounced inflammatory response that can happen after children are infected with COVID-19 that is likely driven by the immune response to the virus. Next slide, please. So I've already referred to transmission and how this is important for us to understand the dynamics of movement of this virus and how we can actually protect ourselves from COVID-19 infection. As a respiratory virus, it is believed to be primarily transmitted through larger respiratory droplets. So these are droplets that are generated when you cough or sneeze or and are infected with the virus. And these droplets really can only go about 2 meters in distance before they land onto surfaces. Now that's causing kind of drawing an artificial line. We recognize that there's a bit of a spectrum of the size of the droplets that are generated anytime someone's infected with COVID-19 and coughs and sneezes. And so there are some smaller particles that can be transmitted a little further as well, but the vast majority of that transmission risk is within the 2 meters of a person who's infected because of these larger droplets that are generated. Now, because it can also contaminate surfaces around that person who's infected, there's a component of what we call contact transmission also involved. So that means that if a table in front of a person who's coughed or sneezed has droplets land on it, and you happen to touch the surface of that table right after that, there could be viable virus that's still on that surface of the table. And if your hands then touch your nose or your mouth or your what we call mucous membranes, your eyes, you may then infect yourself. So you could introduce a virus into the parts of the body where there's cells that are able to be infected with the virus and you can get sick. Next slide, please. So recognizing how it's being transmitted, it's important to think about what we can do to try and stop that transmission. And this really speaks to what are we seeing on a larger scale when we look at populations where COVID-19 is active? How infectious is it? And I mentioned it's more infectious than the influenza virus. One of the ways that we can measure this is by calculating what we call an effective reproductive number. And essentially what this means is you're looking at how many additional people can be infected by one person who's infected with this virus. And so the higher the reproductive number, the more risky it is for people, the more infectious the agent is. The lower the number is, obviously less infectious it is. But this is not a static number. This is something that we can influence or affect, which is why we call it the effective reproductive number. And so if we put certain measures in place, then we are able to bring that reproductive number below below 1. And that's the goal, to actually be able to control an epidemic. Try to keep it below 1 and sustain it at that level. And so if you see on the right-hand side or the one side of the screen, there's a graph that outlines, this is from a study where they published the experience in Wuhan, China, as they implemented progressively a number of different public health type measures to control the epidemic. And early on, without any strong interventions, you can see that the estimated reproductive number was approaching 4 at its peak. But as they started to do things like lock down the city, you can see a massive decrease in the number of cases and therefore also the reproductive number, so that they were able to eventually, through centralized quarantine treatment, improving the capacity to provide medical treatment as well, in addition to the lockdown measures, get this below 1 for a sustained period of time and therefore interrupt and completely stop the major spread of the epidemic. So the kinds of measures that we put in place to stop transmission in broad terms include infection control measures. And this is, hand hygiene, trying to wear masks or personal protective equipment to stop transmission from person to person. Public health measures like closures of schools, interrupting businesses or stopping businesses from running, locking down the city and restricting the movement of people. Travel restrictions, and vaccine, of course, which is what we're looking forward to. Next slide, please. So in broader terms, again, the things that we need to do to try and stop transmission include improving our detection. So trying to get everyone who's symptomatic and could have COVID-19 tested and getting them isolated so they can't infect others. And also applying that principle to the close contacts of those people so that they cannot expose other people. And an important principle there is that in the days before you actually get COVID-19 symptoms, if you're infected, people can be infectious to others. So that's really important in terms of the contact tracing side of managing this. Protecting yourself in public. So there are a few things you can do, like just being aware of what public health measures are being recommended, but also distancing yourself physically from others when you're in public areas, maintaining more than 2 meters. wearing a mask or a face covering when you're in more crowded areas where you can't do that. And of course, sanitizing your hands and surfaces very frequently so that they don't end up being contaminated. Next slide, please. Just another word on masks. I won't spend too much time talking about this, but we kind of use that term quite liberally, and it includes both face protection, but also masks that we use in medical settings, cloth masks that people have been making in their homes, as well as these respirators that we use in healthcare facilities and other places where you need to have very effective filtration of the air around you before you breathe it. Now, that's only really applicable to the healthcare facilities that are caring for COVID-19 patients in this pandemic. But with masks, there is growing evidence out there to support the use of masks in general public kind of settings, not just for source control, so to prevent those who are infected from releasing the infectious virus particles and exposing others, but also for those who are around individuals where they don't know if they may be infectious or not, to prevent them from acquiring the infection. But there are a number of things that you need to consider in terms of mask use, like there are risks of self-contamination if you're not putting it on or taking it off properly. So you need to be comfortable with how to actually use your mask well. And some people do develop some problems with skin irritation or breathing problems as well. Next slide, please. So I'll quickly go through some of the things we can do to mitigate risk during gatherings as we open up. So again, the maintaining 2 meters is very important. Limiting the size of your gatherings and try not to hug or kiss. If you can hold them outdoors, that's really one of the things we'd recommend, or opening the windows in your home as you do so, making sure nobody's unwell. So, really trusting those that you're inviting to your gatherings, and not sharing food, because you can actually have contamination of food reservoirs and cause infections that way. Singing is controversial, but there have been some studies that have shown large outbreaks in choirs that have been singing in closed environments, so it's currently not being encouraged. And you might want to consider the use of non-medical masks. Next slide, please. Now, what can we do with childcare in childcare settings? We don't know a lot about transmission within children, partly because they often are not coming forward for testing, and we've also been protecting our children more, so it's a bit of an artificial situation. So we don't really know, but we suspect that they are less severely infected and less susceptible potentially to infection, but we're not entirely clear. And we don't think that children at the moment are major spreaders of COVID-19 from the data that we have in examining clusters of infections in families. Next slide. So what the kinds of things we're trying to do, though, recognizing that we have limited information on childcare settings, is physically distance. And so some schools or childcare agencies like daycares are staggering the classes or reducing the sizes, staggering the breaks that they have, and using online learning as well. But also improving the ventilation in some of the older buildings where childcare and schooling is occurring, and having some physical barriers in place. We talk about administrative controls, like educating people on policies of sick leave policies, but also what to do for cleaning your hands, et cetera, and enhancing the amount of cleaning that's happening in the environment. Now, masks are not practical for use with children a lot, but it is something to consider. But young kids really don't tolerate them. So under the age of 2, it's not recommended at all. Next slide, please. If you happen to have to care for someone with COVID-19 infection, then there are a few things that you can do, mostly covered in the slides I've already talked about, but you can dedicate the bathroom of that person so that others are not using it, if that's possible. You wear a mask or gloves when you're actually contacting that person's body fluids, or you're in very close proximity to actually provide care. Don't share things like towels or utensils, eating utensils, but regular dishwashing of your utensils is fine. And cleaning your high-touch areas in the household are also, that's important. But usual household cleaners are effective at getting rid of this virus. You don't have to use anything special, really. And finally, washing your hands. I can't emphasize that enough, but very frequently, and especially before eating or preparing food. Next slide, please. Final word is about immunity. So you can achieve immunity to this virus, and this is really what we're banking on to actually end this pandemic, is having people immune to it, so we don't have transmission the way that we are seeing right now. Natural immunity occurs if you happen to get COVID-19 and you recover from it. We actually don't know how long lasting that immunity is. And with other respiratory viruses, like other coronaviruses, we see that they're seasonal. In other words, your immunity does not last longer than more than 3 or 4 months in many of those cases. We're hoping that's not the case here, but we recognize that might be something we have to deal with. You can also get immune if you've been vaccinated and it's an effective vaccine, and there are multiple vaccine trials that are out there right now. So a lot of effort into it, but it takes years to often develop vaccines and get them out there. So let's hope that with the right incentive, we'll be able to get it out there quicker. And then a word about herd immunity. So this really refers to if enough people become infected and immune to it, then it actually confers protection to those around them, even if they are officially susceptible. This is not something we're trying to promote. We're not asking people to go out and get infected so that you can protect those around you. That is really kind of unethical in many ways, and subjects people to very life-threatening illness. But it is a concept that's been discussed, so I did want to mention it here.